Hello, I'm Dr Ian Strawford and I'm the Medical Director of Skin Excellence Clinics. Have you ever heard of the O Shot? Are you a woman that's suffering with a loss of the ability to have orgasms, or possibly after childbirth or later in life? Or have you never had that enjoyment? Are you finding that sex doesn't give you the sensation that you wanted, the pleasure that you wanted? That may be part of the aging process. Let me tell you about the O Shot, which stands for Orgasm Shot, and how this simple injectable treatment can maybe restore your sexual health and give you back those orgasms you wanted.
What is the O Shot?
So the O Shot, and it stands for Orgasm Shot, which all sounds very exciting, but it is a medical treatment and it's utilizing the regenerative capacity of your body. We're using something called PRP, or platelet-rich-plasma, harnessing the growth factors that are in platelet cells and using those to regenerate the tissue in the area where they're injected. And in this case, we're injecting them into two areas of the female body to help restore orgasms and improve sensitivity. So we're injecting into and around the clitoris and the clitoral head, which is obviously an area of the female anatomy that is provides a huge amount of sensation and is linked to the ability to a woman to have an orgasm. But there is another area inside the vagina, just inside, which is behind the urethra, which is the tube from the bladder that empties our bladder. It's well known as the G-spot. This is an area where there is an increase in nerves and nerve density. And it is also thought to be part of the orgasm process and the sensitivity that women feel during sexual intercourse. So we're injecting the PRP and those growth factors directly into those two areas, the clitoris and the G-spot. And that is effectively what makes up the treatment that is called the O Shot.
How can the O Shot help me?
So the O Shot can help a lot of women who have lost sensitivity, maybe lost the ability to have an orgasm through that loss of sensitivity. And that may have happened. It's quite common following the trauma of childbirth and a baby passing through the birthing canal, that those nerves and those nerve supply can be affected and damaged for the long term. It could also be part of the aging process. We know that nerves degenerate as well in lots of parts of the body with the aging process. So it could be a combination of things. But by trying to regenerate the nerves in those areas, we can improve the sensation and the messages that are going back to the brain. And that is part of the way that we can heal the body to hopefully restore a normal or orgasmic process during sex for women.
Is the O Shot painful?
So the O Shot sounds like it could be very painful if we're injecting into those areas with a needle. But we use local anesthesia in the form of topical anesthetic, which is applied to the area for at least 30 minutes. And I do something called a clitoral block, which is where we use very small amounts of local anesthetic to block the nerves directly to the clitoris and the G-spot area. So that creates, in most cases, a complete numbness of the area when we're actually doing the procedure itself.
How many O Shot treatments will I need?
So in most women, they need between 1 and 3 procedures to get a healthier functioning and to restore those nerves. The treatment itself has an effect which may be gradual. So it may be a number of months after one of the O Shot procedures before you can see whether there is any improvement in sensation and whether we're starting to restore orgasmic function again. It's a complex problem, and often there may be other issues that we need to take into account, such as postmenopausal tissue symptoms, and that's where we may combine it with hormonal treatments or other treatments to help in those areas as well. But most patients are going to start to see some benefit, if they're going to get some benefit, after 1 or 2 treatments.
What happens after my O Shot?
So on the day of the procedure, when you've had your O shot, then you're anesthetized. So immediately afterwards, there is no pain or discomfort. There can be some localized discomfort, especially around the clitoral head, with increased sensitivity and maybe some discomfort for a number of days after the procedure. We advise that sexual conduct, sex should not be resumed for at least 72 hours after the O shot. It can be, there's no danger to starting before, but we think it's best to allow things to settle down completely before you resume normal sexual activity.
Is the O shot guaranteed to help me?
So the O shot has helped many, many women restore orgasmic function. And if the diagnosis is correct and there are no other perhaps psychological or other associated issues, maybe even medication that patients might be taking, such as some of the antidepressants, which can affect orgasmic function. In most of those women where we're not dealing with other medical conditions or medication, then the majority of women do see a response to the O shot. It's not guaranteed, but in my experience, if we select the right patient and they're having the treatment for the right reason, then there's a good chance they'll see some benefit from this treatment.